Mike, is a great segue to you, because I know you've been working to help providers identify those competencies that's needed to successfully execute the alternate payment models that is in fact moving from volume to value, right? And so you've written that in the Vital Direction series. So what are those key challenges facing the providers, and then what would you recommend the next president to do to facilitate those necessary progress?
So, Victor, I still get to give my short speech to the president in the elevator?
Yeah. Three minutes.
All right, thank you. I think I would first of all say, Mr. President-elect, just a second. Or I would say, Madam President-elect. On my time. I would say I'd like to remind you how quickly 4 years goes by. It's very short. And my suggestion is that given all that's done, that you remember how important it is to focus on finding the big gears in the mechanism of health that will in fact turn all the little gears once you turn them. And I would focus, if I were you, on the payment system, because I believe it's the most significant change that's occurred in healthcare in 75 years. And I believe it's the area where you can gain bipartisan agreement. It is one of the areas that Republicans and Democrats agree upon. The challenge won't be the politics. The challenge will be finding a way to organize this and to use the government not as a means of operating the healthcare system, but organizing it in a way that all of the innovation that exists in America can be put to use through a mechanism and a structure that actually works. I think I would remind him that, at least when I was elected governor in 1992, there was no email, there was no e-commerce. I made a point of bragging about the fact that my state had the first website. The vision was there. We knew what this new thing we called the internet could do, but it needed structure, it needed protocols, it needed standards. And this remarkable new payment structure that we're just at the beginning of needs the same thing. And I would say to the president-elect, you have the opportunity in these short 4 years to lay down that framework, and if you do, it will drive the big gear, and all of these smaller gears of innovation, in fact, will be able to turn. But you won't be able to do that simply by having HHS, and I speak with some knowledge about this, be able to simply define what those protocols and standards will be. You have to unleash a culture of collaboration where people begin to work together to figure out, to document, and to be able to then develop these protocols in a way that can begin to work, and you can put the government and its payment structure behind it and drive it. Because it's been my observation that as well-intended and as noble as all of us are that have been in government and continue to be in government, we're not as good at innovation because we have to operate through a process that makes it difficult to be the innovator, but we can be powerful engines of innovation with all of those who are out in the private sector driving it. So my suggestion, Victor, is payment, harness the private sector, give it shape, and create a culture of collaboration.
Terrific. Thank you. Thank you indeed, Mike. And Tom.